Prime Minister says financial responsibility is key in formulating the country's next budget. We'll have details to this story and more in the National Report. The details to the news for Wednesday, September 8, 2021. I am Christian Mitchell. Prime Minister Dr. The Right Honorable Keith Mitchell says financial responsibility will be a key factor in the formulation of the 2021-2022 budget. This means that spending will be cut into several areas that are no longer relevant and increased where necessary. Dr. Mitchell said this is largely due to the significant adjustments that will be made by the various government departments in their submissions for inclusion in the budget. These became necessary as a result of the impact of COVID-19 on the local economy. Dr. Mitchell was speaking during the annual budget retreat held virtually on Wednesday. The budget retreat gives policymakers and technocrats the opportunity to hold open discussions on the priority areas for the next fiscal year. Dr. Mitchell said everything that is being done now in preparation for the upcoming budget must be guided by the present atmosphere.
We have to ask ourselves more seriously this time around whether in fact the adjustment could be as we normally operate. I say that in the context, for example, with the present pandemic, even within our own country, the question of travel has been affected considerably. So when we look at the items within our budget for traveling in each ministry, we have to accept the fact that that item has to be a minimal amount.
Dr. Mitchell also highlighted the importance of sound planning in preparation of the 2022 estimates of revenue and expenditure, considering that COVID-19 is forcing a shift in focus.
Financial responsibility would be a key factor at the micro and macro levels. I cannot overstate this particular issue. I also want to underscore the importance of sound planning. Despite the many uncertainties created by the pandemic, in fact, because of the uncertainties, our planning process has to become far more strategic and far more insightful.
Minister for Finance, Honorable Gregory Bowen, says the budget will be based on government's strategic priority agenda for recovery, transformation, and resilience, as outlined in the Medium-Term Action Plan 2022 to 2024. It will include measures that can be implemented to enhance Grenada's fight against COVID-19.
The 2022 budget will of necessity focus on safeguarding lives and livelihoods and protecting the most vulnerable in our society. The various multi-years, medium-term action plans are the vehicles through which the National Sustainable Development Plan 2020 to 2035 is being implemented. The medium-term action plan for the period 2022 to 24 sets out the strategic actions for implementation during this period, responsible entities, performance indicators, and alignment with relevant sustainable development goals. COVID-19 has ushered in new imperatives, especially in the area of health. The health crisis highlights the need for Grenada and the other Caribbean countries to actively implement public health measures in all areas of function. That is, to prevent diseases, to prolong life, and to promote health. These measures should be undertaken through the organized efforts of individuals, communities, and institutions in society.
The Ministry of Health has increased its bed stock to accommodate more COVID-19 patients on the isolation wards at the General Hospital. Director of Hospital Services, Dr. Carol McIntosh, says with the pediatric ward being converted into another isolation unit, more beds are now available. This unit can house a maximum of 49 beds, in addition to the 11 beds in the first isolation ward and 13 in stock.
We had to convert the lower level of the general hospital to our isolation ward. We had to move our pediatric ward upstairs into another ward and distribute our patients accordingly so that we would have the entire floor. And as I stated before, that can allow us for a maximum of 49 beds. And if necessary, we can increase that further. So we have increased our number to try to just stay at least one step ahead in preparation for if there are any need for hospitalization. And to how to decrease that hospitalization, as you hear the Permanent Secretary talking about in the community, how do we make sure that people stay healthy?
Health and Social Security Minister Honorable Nicholas Steele said more adjustments will be made as government continues to monitor the response to the increase in COVID-19 cases.
There is a phase 3. We are now in the phase 2, which when we prepared the first ICU unit, the 15 to 22, now that we are seeing that maxing out, we have gone to the lower level, which is approximately 47, and then the phase 3 would be to either take on another floor and move services to Princess Alice, or have Princess Alice completely be COVID. So it's going to be one of those, but it depends. The reason why it seems like there isn't a final decision, it depends on the stress on the other sections of our hospital services and community services that will dictate what moves to Princess Alice as we try to accommodate the additional cases within the system.
The Ministry of Health extends deepest condolences to the family of the late Dr. DeVille Ray, house officer in pediatrics at the General Hospital. Dr. Ray died suddenly Tuesday morning. Health Minister Honorable Nicholas Steele described the late doctor as a valuable member of the healthcare team. He said, and I quote, Dr. Ray has been providing yeoman service in the pediatric department and is one of the stalwarts of the healthcare system. He was reliable, dependable, going above and beyond the call of duty, and a ready volunteer to extra service. Dr. Ray was 33 years old. He had so much more to give. We will move on, though, because there is still the emergency and the urgency of the COVID-19, despite the fact that we have lost one of our soldiers, unquote. Outlining the extent of Dr. Ray's dedication, the minister indicated that since completing his internship, Dr. Ray has not taken any vacation. Dr. Ray, a scholarship awardee who studied in the People's Republic of China, has worked at the General Hospital since 2015. In addition to his immediate family and friends, the Ministry of Health extends condolences to the medical team and other members of the healthcare team who worked with Dr. Ray. This is the National Report. The news will continue after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Welcome back. The Ministry of Transport has described as unfortunate the call by the National Bus Association for bus operators to suspend their operations for 1 week, and at the same time, it has commended the operators who opted to continue providing critical public transportation services for commuters across the country. The call, issued via a press release on Tuesday, was heeded by some bus operators, leading to some measure of disruption. However, the Ministry of Transport is heartened by the reports confirming that public transportation is operational along all major routes, as the services of the bus operators are important in keeping the country moving. The government is acutely aware of the critical need to balance lives and livelihoods, but it also notes that consultation and collaboration will help to better guide collective action that will not jeopardize any one sector or group of persons. Prime Minister Dr. The Right Honorable Keith Mitchell has repeatedly called for collaboration, unity, and partnership in making decisions that are in the best interests of the country, particularly at this time when we are all battling the impact of COVID-19. Since the start of the pandemic in particular, government has provided crucial support to the public transport sector, including sanitization, benefits in the COVID-19 economic stimulus support package, and the removal of terminal fees to help buffer operational costs and ensure that this service remains available for users. Further, there is a commitment from government to continue exploring measures that will bring relief not only to the transport sector, but to all categories of persons impacted by the pandemic as it juggles the competing needs of various sectors. Finally, in the news, the Ministry of Health is assuring residents in Carriacou and Petite Martinique that systems are in place to adequately respond to any increase in COVID-19 cases on the sister islands. The response strategy includes the effective and safe transfer of patients who may need further medical assistance on the mainland. Director of Hospital Services, Dr. Carol McIntosh, has indicated that health officials will closely monitor persons who have tested positive to facilitate an early determination of the need for transfer. Carriacou currently has 19 active cases of COVID-19. The origin of some cases cannot be traced and is therefore suspected to be the result of community spread.
We're continuously monitoring all of the patients who are positive, and you look for particular signs that would show, are they worsening? Are the signs increasing? If that shows up, our threshold is lower, and we allow for them to be transferred to Grenada. So we allow for them to be coming into Grenada sooner as opposed to later, and allow for people need to understand that even if you're at home, monitoring yourself, monitoring what's going on with your symptoms, and having that interaction back and forth. And if you're feeling worse, do reach out so that we can make sure that we identify and bring people in.
That story has ended the national report for today, Wednesday, September 8, 2021. On behalf of the entire news and production team here at the Government Information Service, I am Chrisanne Mitchell saying thank you for joining us. Until next time.